So let's get started. I'd like to call to order the Mayor Commission work session. Today is Tuesday, January 17th, 2023, and the time is about 10:03 a.m. So, Ms. Johnson, are you going to key up number one, or?
Yes,
Please.
sure, Mayor. Good morning, Mayor, Commission, staff,
Morning.
members of the public. So item one relates to the F resolution that the board approved at the last meeting, moving $500,000 from the general fund discretionary budget into the budget for the Office of Small and Minority Women Business Programs for a proposed program. We had mentioned this to the board back at an August work session in 2022. Mr. Hayden and his team have now worked out the proposed guidelines. So the money has been moved. This is the next step to now present to the board the proposed program so that we can hopefully at the end of the discussion get the board support to move forward as this item is teed up for your January 23rd agenda. With that, I'm going to turn it over to Mr. Hayden.
Thank you, Ms. Johnson. Mr. Mayor, Madam President, board members, Ms. Johnson, my name is Frank Hayden. I'm the director of the Office of Small Minority Women Business Enterprise. And the mayor made that statement that is a very long title. And Sandy tried to cut it down, so I'm using letters, O-S-E-M, but I messed that up. So I'm just going to stick with what I know best. So this morning will share with you our proposal of a conversion of our loan program to our grant program. And so once I'm done, we'll entertain any questions you might have, and so that we can move this forward. And as usual, things don't wait. There you go. As I indicated, this is the intent to convert our loan program to a grant program. The loan program was started in February of 2022, intended to issue loans between $5,000 to $20,000. We issued 5 loans to date that came to a total of $95,000. There were 56 applications that we received for that program. And the reasons for the ineligibility was some of the companies were outside the geographical area of the city of West Palm Beach, that the debt to profit ratio was too much, and they were not certified as a business with the city. What we're referring to now is our First Steps grants. The city's Office of West Palm Beach, Office of Small and Minority Women-Owned Business Program, is pleased to offer to our certified businesses a grants program. And there are 4 typical grants that we will be offering: marketing grant, an inventory equipment grant, a property improvement grant, and a new business grant. These are the basic categories that all of them will have to meet to be eligible. The following minimum eligibility criteria will be the same for all grants. Business must be certified. The business must be located in the city of West Palm Beach area. The business must have no outstanding liens or violations, pending litigations with the city of West Palm Beach or the West Palm Beach CRA. Business must be a nonprofit. Business.
Now, for profit.
I'm sorry, for profit. Thank you. I'm sorry. Business must be registered with the state of Florida Division of Corporations, and the business must submit a W-9 with the grant application. The marketing grant, the grant amount, the city will match 50% of the amount spent by the business to implement the marketing advertising plan, not to exceed $20,000. The funding terms of grants will be awarded on a reimbursed basis upon the city's receipt of the required deliverable documentation. In addition to the grant application and proof of eligibility, businesses will be required to provide all the following documentation to receive the grant's funds: a copy of the business branding plan, marketing plan, or advertisement plan created in the past 2 years by an independent public relations firm, proof of implementation of the marketing or advertisement plan in the form of a website or signage or advertisement, copies of invoices for the cost of the marketing advertisement plan, and the applicant should submit for electronic payment.
Before
Yes,
you
sir.
continue,
Want me to go back?
Mr. Hayden, no,
Yes.
no. I just wanted to let the commissioners know, we will make sure you get a copy of this deck. I see you, a couple of you are taking pictures, but we'll make sure that we get you a copy of the deck soon. Won't we, Mr. Hayden?
Oh, yes, sir, Mr. Mayor. Matter of fact, I have them over here. They're hot and ready and so forth, so.
You want to hand them out?
If you have them, that'd be great. Mayor, would you like for us to pause for questions on each proposed grant, or you want to wait till we get to the end? What's the preference?
Well, no, I mean, I don't think this is a shy group, so if they have a question, they'll hold up their hand and we'll see. We got a question right there. Yes. Commissioner Warren.
Oh, yes, Commissioner.
My question is about the, that they have to have an advertising plan that's created by an independent public relations firm in order to qualify. It would not be something that we could support if they do an independent marketing approach on their own.
Kim, you have to come this way.
Usually when they have a marketing professional look at their business, they hit all the different areas. So it's just safeguarding that. And we allowed firms to have a consultation with a PR firm last year. We gave them the first hour free, and they were able to create business plans. So there are some, or a number of firms took advantage of that. And it's not easy, it's not hard to do. You go to a PR firm and you talk to them about what you feel your vision is. And it's a little costly, but we're giving out grants for that purpose, so.
But the grants are on a reimbursement basis, and I'm just thinking of a business's ability to afford to do this up front.
And Commissioner, our plans are all very, very flexible. And so there is a possibility, depending on the company, depending on their circumstances, that we could make some exceptions in terms of doing that. It is not rigid, cut in stone kind of thing. But we want to lay out some criteria just to make sure people are doing what it is we want them to do.
Hence the purpose of a grant. I guess that allows us the opportunity to be a bit more flexible based on circumstances and what the staff determines is the best way forward.
Yes, ma'am.
But I think it's important to note that while we are doing grants, we want to be wise about the companies that are the recipients of the grants. It's not like we just are throwing money out there. So when we have a number of these requirements, a lot of it is meant to help the companies themselves be more disciplined in their approach. So, you know, I would like to see the grant program enhance a company's ability to be successful.
Right.
All right, Commissioner Lambert and then Commissioner Ward.
I'm grateful for some flexibility. And Mayor, to piggyback off what you said, I think the other thing that these grants do is to help introduce other opportunities that maybe they couldn't afford before. Yes. So I appreciate what you're saying about giving them the extra funds so that then they can maybe hire a professional where they might not have been able to before. I am always grateful for some level of flexibility, but I did have a question because I don't know who mentioned it, but that is staff making those decisions of that flexibility, or would that come back? What's the process for that?
In our loan program, I was making that decision in terms of the flexibility. If it was of a legal matter, I'd bounce it off our legal department, just to ensure that whatever decision I was making was not going to get the city and me in trouble. So that's kind of the way we'll run the grant program as well.
And so on this one, when it said that the marketing, there's a proof of implementation of a marketing advertising plan, I'm sorry, wherever you said that it had to be an independent,
Number one.
thank you. Independent public relations firm, is that a Frank Hayden decision, or is that a Frank Hayden taking it to a legal department decision? I'm just,
It would be a Frank Hayden and taking it to a legal department to get the decision.
thank you.
Commissioner Ward?
Kind of addressed what I was going to say, but I just want to add, because I guess this is more for legal. It says to provide all of the following documentation to obtain the grant funds. So where does that wiggle room come in?
And Frank, if I may, I thought what I heard you say was that we were going to be flexible in terms of whether or not the 50% money that was being spent was an upfront or reimbursable, but that the deliverables would still be the deliverables for the.
And you are correct in terms of that, but I think the point that was being made by some of our commissioners was for this getting an independent person to put together your plan. If the company came back to us with a plan, but it wasn't done by a professional and it was a good plan and we thought it was good, then we could be flexible on that. But you're right, in terms of the documents that we're asking them to provide, that is not one of the things that we're flexible on.
Mayor, if I could,
Yes.
one of the ways that this could be addressed, now these are proposed guidelines, but as part of that requirement, certainly you can add a provisor in there that, alternate plans may be considered at staff discretion, based, on a case-by-case basis. You can put some kind of qualifier in there that would indicate the flexibility as opposed to not having it stated at all.
Yes.
But the intent is not to bring each grant application to the board to have that continue to be done at the staff level.
Right.
That was my point. I just wanted to make sure that if we say all, that does sound like we're agreeing to all. And to Commissioner Warren's point, what if someone's coming to us and saying, hey, I want to be able to hire an independent public relations firm to have this plan set out, but I have no funds to do that, and they're starting at square one. How do we get them to that point where, okay, yeah, that's your plan. Your plan is to have a plan, but you don't have the money to, implement it.
So, yeah, we can put
We
some
can-
kind of
we can make
provisor
those
in the
changes.
guidelines.
Yes.
Absolutely.
Commissioner Lambridge, I see your hand up again.
They addressed it, thank you.
We're good?
All right, good? Okay.
All right,
Thank you, sir.
Then we'll have an inventory and equipment grant. That will be, the city will reimburse up to $50,000. The grant will be awarded on a reimbursable basis upon the city's receipt of required deliverable documents. And it lists here for those deliverables, in addition to the grant application, proof of eligibility business will be required to provide all the following documentation to obtain the grant funds. The business will have 6 months from the date of grant approval to provide the deliverables. And that's the list of those items that we're asking for as well.
Okay.
And we also have a property improvement grant. The city will reimburse up to $50,000 for that. Grants will be awarded on a reimbursable basis upon the city's receipt of required deliverable documentation. In addition to the grant application and proof of eligibility, business will be required to provide all of the following documentations: evidence that the necessary building permits were obtained, documentation evidencing that the business neither owns the property being improved, or has the consent of the property owner to remodel or make improvement. Copies of all invoices, receipts, proof of payment for the remodeling work, and all improvements. Applicants to receive electronic payments.
President Fox?
Thank you so
I'm
much.
sorry.
I think this might apply to many of these categories, but when we're reimbursing, I mean, is there a way for them to have applied to know that they're going to be getting this before, I mean, I know that they need all these documents and invoices and things, but so there's not a way, I guess, to apply and know you're getting the grant before you actually do the work?
That's a good question. And yes, I'm going to assume, but we'll get our heads together on that. Yes, I wouldn't want you going out there doing all of this and then I come up and tell you, no, we're not giving you the money. So yeah, they'll have the approval when they submit the grant application to us, then we will approve it, and then they just have to meet those requirements in order for us to make that happen.
Yeah.
But yes, they'll know they are approved before they start the work.
Commissioner Ward?
I'm assuming there's more flexibility on that 6 months, because, given permits being obtained?
We will put language in there that allows for flexibility for that as
It's
well.
on us, you know, to
Yes,
delay.
I understand. It could take much longer than that, dealing with entities.
Be careful now.
Yes, sir, I said, yes, sir.
We're all on the same team.
That's absolutely right, sir, very true. Yeah.
Any other questions? Okay, Mr. Ayton, you can continue.
And then we have what we're calling a new business grant. City will reimburse up to $20,000. Grants will be awarded on a reimbursed basis upon the city's receipt of the required deliverable documents. In addition to the application, eligible business will be required to provide all of the following documentation to receive the grant: certificate of completion or attendance recorded by the city-hosted training such as the Entrepreneur Training Program, Bonding Series, the Mayor's Jumpstart Academy. And that is what all the other applicants will receive, electronic payments in regards to that as well.
Commissioner
sorry.
Warren has a question.
Yes, ma'am.
So the business can choose which of these items, which of the criteria in section 1 they would like to complete and submit that. They don't have to do all of them.
No. Any one of those. I'm sorry. Yes, ma'am.
And how often are they available, the Jumpstart Academy and the Entrepreneurship Training Program?
The Jumpstart Academy is an ongoing program that's going on. We have offered the bonding series program that a number of businesses went through. The entrepreneurship training program, we're in the process, that will begin soon. And so these programs are already in existence and people are attending them, and so they'll be in position to that. If, as we move along with this, there are some that have come along who have not, we can direct them to such programs so they'll be able to take advantage of those as well.
Okay, so they don't have to wait 6 months or 3 months. It's ongoing, and they have the
Yes.
opportunity to enroll at any
That's
time.
absolutely right. Yes, ma'am.
Commissioner Ward?
You say city hosted, so the one by 1909 that's been ongoing, that would not qualify, or are we focused on partnerships?
It was not one that was listed, but we could consider making that a part of our requirements as well. We'll just have to take, in my opinion, we'd have to take a look at what it was they provided, what they offered.
Right.
And then make sure that it's going to be beneficial to what we need here in the city. And if it meets those criteria, and if our legal department and administration says that it should fit, then we'll put it into play.
Yeah, it was just city hosted could be maybe, or a like not-for-profit, something like that, because there are other organizations that provide those services as well within the city.
Well, but I think part of it, having a city hosted, we know what we put into our programs.
Yes.
All right, and this is city dollars. So I don't want to open it up too broad because we don't have control over and we don't necessarily know what some of these other nonprofits are doing. So that's why I think it's not a bad idea to have a city-sponsored program because we know what goes into that. And since these are city dollars, you know, we want to make sure it's going for, that they have received training that we believe is sufficient. President Fox.
Thank you. I just wanted to say that I think 1909 is actually funded in part by the city, that program. So, but I was just going to ask, these other 3 programs that you list here, are they, I mean, is there an application requirement? Does everyone automatically get in? Is there going to be any issue with, you know, people being accepted to those programs?
They are not. There's no application. We notify the businesses that these opportunities are there. They can choose to take advantage of it, or they do not have to, but they are notified that they're out there, and that they are available for them to take advantage of.
Commissioner Lambert?
Thank you. I would be interested in having some flexibility, and maybe there's some language we can add in there that says, you know, if their curriculum meets our very high standards, because I think Palm Beach State may have an entrepreneurial program as well that might be stellar. I've not gone through it myself, but Mr. Hayden, can you remind me, what is the size requirement to be considered a small business?
So help me. Come, don't whisper.
If it's a construction firm, it's less than 9 million gross receipts average over 3 years. If it's in professional services, it's 5 million gross receipts average over 3 years. And if it's commodities or services, it's also 5 million.
Okay. And so that's the threshold. I presume that there's no minimum threshold. You could have yourself as an employee, solo entrepreneur. I'm curious. I presume that it's an industry standard that these grants are set up as a reimbursement, but maybe you could just talk to us a little bit about why we do them as a reimbursement versus a grant that they didn't have to pay for first.
Well, I think the object behind it, and I'll ask our legal to chime in.
I'm happy to, but the purpose
As
of a
am I.
reimbursement is to make sure that you in fact get what you're wanting them to use the money for, instead of just giving it to them first, and then it's difficult to claw back if it's gone and they haven't used it for the purpose for which you've put it out there for.
I would just like to add a footnote, not to cut you off, Commissioner Lambert, but it is always a best practice in municipal government that you give out funding on a reimbursement basis as opposed to giving money up front. That is just fraught with problems, and it is something that the board should not consider under any circumstances, irregardless of track record. We don't give out money up front. I mean, it's similar to employees. We have to work first and perform to get our paychecks. The organizations need to work first, pay out, and get reimbursed from the city. All right, let me turn it back over.
Thank you. Did that answer your question?
Yes, it did. And then I have a question about the marketing grant. So I noticed that one is up to 50% of the amount spent by the business, where the others are not. And I'm just curious as to the reasoning behind that as well.
Let me bring the boss up for her to.
Thank you.
Well, the sky's the limit with marketing. You can get a billboard, you can have a campaign that encompasses years. I mean, it's just too large to give out the full amount instead of just 50% of the campaign. And the, let's see, there are examples of some, like a website that's proof of getting the money, advertisements, media buys, promotional materials, all those things are
Sure, I
fair
understand
game.
that, and I'm not saying I'm against this, I just wanted to know the reasoning behind it, because the others didn't have a 50%. So in this instance, the organization would need to spend at least $40,000 to get the maximum $20,000. In the others, like the property improvement, they don't have to spend $100 to get 50. I certainly understand the sky is the limit with marketing, but probably the sky is the limit with
With any
property
of the other
improvement
things,
and
too. Yeah.
equipment as well. I was just curious, what was the reasoning behind that?
We didn't think that there was gonna be that big of a dollar amount because of some of the plans that were coming through last year with a consultant that we had. So that's why we did it this way, but it can be
Or maybe
changed.
it kind of seems like we almost want them to have skin in the game in the marketing, where on the others, and my thought was, but I wanted you all to confirm this or dispel this, is that maybe the others, they would have to be putting in a ton more than that, and likely for them to spend $50,000 in property improvement, they're already spending 200,000.
Right. And once again, that's one of the good things about these workshops. You raise concerns and questions, and we'll go back and resharpen the pencils and try to make those improvements that you're bringing up.
Commissioner Baduzzi.
If we could just briefly go back to the reimbursement basis, and I hear our city administrator that it's a best practice, and it does make sense because I think it's certainly is going to help weed out whether purchases are appropriate and all that. But presumably, there's a need, and these are kind of need-based. We're supposed to be helping small businesses here. And if the small business is in the position to put out $20,000, $50,000 up front, do they really need this assistance? And I know from, running a small business that often, the cash flow and being able to purchase things is difficult. Is there a way that we could look into somehow, something in between, a hybrid where we don't just write a blank check to them and have to claw back if they don't spend it, but maybe something like they have to provide us with invoices for something, and if the invoices get approved, then we maybe write the checks directly to those entities, or something like that. I'm just concerned that is there really a need if they have the capability of putting that kind of money out and then seek reimbursement.
And once again, Commissioner, we'll take all of what you all have shared with us, and we'll get our heads together and figure out the best way to make this happen. Because you're right, our intent is to help these small businesses be successful. And we don't want to put roadblocks in their way that's going to prohibit that. But as our city administrator says, we also want to make sure we're protecting the city money as well. So I think we can meet halfway to accommodate our businesses out there and at the same time safeguard the resources that we have here at the city.
Commissioner Ward.
To follow up on that, because even when you're talking about just like inventory in particular, obviously they can provide that listing of inventory and equipment purchase, so that vendor probably has a time frame in which they need to be paid, and it may not be 6 months, it may be 90 days. And so that, I feel like that could be where we could show some flexibility if they're providing all these invoices and proof of payment. If they can't get it because they've got to wait that 6 months, a lot of vendors aren't wanting to wait that long to get paid. So I feel like that's an easy way that we could help out and say, okay, if you're going to provide these invoices and they're due within 60 days, let us help out. Obviously, it's difficult for each circumstance, but that seems to be more reasonable.
Well,
Yes, ma'am.
now, I was just saying, as Mr. Hayden said, we'll take a look at it. I think we have to strike that balance between what concerns the board have mentioned about making this program as user-friendly for the businesses in terms of getting the money out the door. That's certainly what we want to do, but at the same time, making certain that we are protecting the public dollars. So we will regroup and take a look at that particular area to see how can we strike that balance.
Yes, sir. Just to kind of bring this to a finish, on our disclosures, these are the items that we'll be looking at to ensure the fact that what we're paying for, we're actually getting in return for that. And to also indicate that if we find out that the applicant falsified some information, what kind of action we can take against those individuals to be able to make that we don't want people just thinking they can come and we're just handing out money and there's no consequences as a result of that. The other thing I'd like to share with you before I ask for any questions is
Pardon my interruption, Mr. Hayden. Can you just go back, because I think it's important to point out and walk the board through the third bullet there, that only one grant may be awarded to the same business. So this program is not set up for a business to then be able to get 4 different grants. So I just want to make certain that that is highlighted.
yes, and I think that's an important item, and we have had discussions with that and about that in terms of making that, because there's a possibility that a business could come and they apply for X, but they also need Y as well. And so I agree that we want to make sure this money gets used by as many people as possible, and not by just a few. And then that kind of leads me into the other piece I wanted to talk about. We want to make sure that there's enough money in these programs to go around. It has been pointed out to us, someone could come for the one grant that's like 50,000, and you get 4 of those, and all the money is used up. But we're going to ensure that that is not the case. It is our intent to do a report, and we don't know if it's going to be monthly or on a quarterly basis, that will show how much money has been used in each one of the categories, how much money is left in the total. If we see one is drawing the biggest from, then we're going to ensure that other folks have a chance and a bite at that apple to get their funds as well. So that'll be a safeguard we'll do, and like I said, that report we'll do will not only go to the administration, but we'll also share that with you all board members as well, so that you'll be aware of what it is that we're providing to our customers out there.
A couple of things, Mr. Hayden. One is, I presume we still have relationships with banks and other lenders that we can hopefully refer people to as they come to us if there is a need for additional capital. It may not be a grant, but they may have to. So that's one thing. The other is, presumably, as we have experience with this grant program, we will tweak it from time to time, and hopefully we will solicit feedback from the recipients as to their experience, some kind of survey or something like that, which will help us to be better in helping businesses help themselves. And then finally, I would remind commissioners that, I'm sure you've read the headlines, obviously when COVID hit, the federal government put a lot of money out, PPP loans and all like that. And again, the motive was to help businesses. And a lot now they are in the process of clawing back and going after different folks who were not as honest, shall we say, with those applications. I don't question the motives of anyone who may come to us, but we need to make sure that we are as protective of these public dollars as we can be, because not everyone is honest when it comes to getting this so-called, quote-unquote, free money. So a lot of these safeguards are really to help us ensure that we have crossed our T's and dotted our I's. Yes, we do want to help businesses, but we have to be careful because these are public dollars. Commissioner Ward.
Will you go back to the disclosures? So, and thank you for pointing that out, Administrator, because the way that language reads, you're saying family member, what, you mean the same business. So if a family member, you apply for a grant for a flower shop and your brother has a cake shop, that doesn't mean that brother can't go after. So I think if you're going to have those disclosures in there, that language needs to be tweaked, because that just looks like, hey, your family, only one per family, even if they've got different businesses. That
Yes,
wasn't
ma'am.
the intent, right? Okay.
No, it wasn't the intent. The intent was that if it is one business, then, and there's a brother that's part of that brother can't come and ask for a grant when the business has asked for the grant. But if the brother has a different business than that business, we treat that as a separate business, not as part, just because. Mr. Mayor?
Yes, President Fox.
Thank you. I was curious, how will you decide how much each business will receive? I mean, if they come in and say they want 50,000, I mean, is it sort of like you're automatically giving people what they're asking for? Just when I'm doing the math, I feel like it could add up very fast to a very small amount of businesses. But just curious what the process will be.
Much as what we did with the loan program, people would come in and request X. but after we did, along with BBIC and Pathfinders, after they did the assessment, he would come back and say, well, yeah, I know that's what you asked for, but this is basically it. It'll be the same thing for the grant program as well. Based on what information they provide us, based on what the needs are going to be and the information they submit, we'll determine whether or not they might have asked for 50,000, but in the end, what we're willing to grant them for will be for X, Y, and Z. So it won't be that you just come in and say, I want this amount of money, and we're going to say, okay, we're going to give you that. You have to prove to us that what you're asking for is something that is going to be used to help you to get to where you are. That's why we ask for all this documentation from them, so we can verify that.
I was just curious if there's any flexibility in terms of what if someone comes and doesn't fit into one of these categories? I'm sure there's many examples, but one that is off the top of my head is there was a business, they do catering, and it's, I guess, a business that we normally use in the CRA for the holiday event. And this year, kind of last minute, their insurance doubled. The insurance that is the cost to do business with the city, I think, is maybe more than if you weren't doing business with the city. So I'm just curious, like, for example, if that business wanted a grant to help them pay for their insurance or something, I'm just curious if there's other opportunities for businesses such as that. I'm sure there's a lot of other examples, but.
Yes, that was one of the issues that I was going to talk about, because it has been brought to my attention in terms of that. It would be not my intention, but quite naturally, if that is a decision that's made by this commission and the administration, that we could do that. What I would suggest, what I would say is, it is a small number of businesses that impacts. This city has made a decision that we are going to pay extra for doing business with small businesses for the like. My choice would be, that's the decision that this commission makes. I mean, this particular person you're talking about, you're right, it costs them $750 more to get the insurance we require. Well, that increased their cost to us, so if we're supporting small businesses, then pay the cost. With construction firms, it's never a problem because the first invoice they send us covers their insurance costs. But for small businesses like you brought up, that doesn't happen. We, as the city, if we make the decision that we're going to pay that cost because we're causing them to gain this extra money, then I'd say do it. But as I said, if that is the will of the administration and this body, we'll figure out a way of making that happen. I just don't think it's a good idea for the city to get into the insurance business, so to speak. But that's just my own personal opinion in terms of that. And lastly, Mr. Mayor, you talked about the survey. We did that at the close of the loan program and got some good feedback from a number of our small and minority-owned businesses, and 90% of it was get a grant program because we don't want to have to pay people money back. So we'll do the same as we go along with this program as well.
All right, and thank you, and don't sell yourself short when you say in your opinion. I mean, you're the subject matter expert. You've been working these fields for a long time. So if based upon your ample experience, you have opinions about what is best and how to best do this project. Don't sell yourself short. Sell yourself short.
Thank you, sir. Appreciate that.
Any other questions on this item? Thank you all very much for, I think you put a lot of thought into it. Yeah. I think initially I'd like to hear from a status report, maybe 60 days, just to see how it is after money starts hitting, and then we'll figure out from there how frequently to come back to us. But I just want to see what kind of initial response we're getting, how much money's going out on the street, so hopefully.
All right.
And just to get back to us in 60 days.
Sorry. And just in conclusion, thank you, Mr. Mayor. I want to thank this commission. This city has been very successful in its efforts to have small and minority-owned firms in the city of West Palm Beach, and that's because of you all's commitment. So, thank you.
By the way, are there any other municipalities or even the county that's putting money out in the form of grants that you're aware of?
Not that I'm aware of, Mr. Mayor.
Yeah, so commissioners, you should certainly pat yourselves on the back because West Palm Beach is leading when it comes to providing assistance for small minority-owned businesses. Commissioner Warren.
Thank you, Mayor. I do agree that this is remarkable, and hopefully others will follow suit and in order to support the smaller minority women and women-owned businesses throughout our community. Going back to a question or comment that Commissioner Ward made as it related to the inventory and equipment portion of the grant. In the third bullet point, where it says businesses will have 6 months from the date of grant approval to provide deliverables. Maybe we can just say up to 6 months, because I think that it's looking, or it may have come across as though it would take 6 months. What we're saying is that if they provide this information, they need to do it within 6 months in order to qualify. Right. Not that the 6 months is the minimum.
Right. But we can, once again, as the city administrator said, we're going to go back and work with this. I think we have an opportunity to talk to you again before. We were hoping to come on January 23rd to get your blessings on this, but we want to make sure that we have dotted all our I's and crossed all our T's and have your approval before we put something in front of you, asking you for your approval.
Yeah. Mayor, if I could, I would like to just remind the board, as you talk about the board's and the city's support for the small businesses within our community, and what this grant program does. I think what one aspect that really underscores that is the fact that as we started out looking at how we could execute this program, we were looking at rescue dollars. And the requirements are so stringent under the rescue dollars that we felt it would be a hamper to small businesses. And the board supported utilizing general fund discretionary dollars so that we could have the kind of flexibility that you all have just intimated. So I think that punctuates the support to our small businesses, and I don't want that to get lost in translation.
Very good point. Commissioner Ward?
And thank you, Commissioner Warren, because now it's actually, I'm a little more confused because it says from the date of grant approval. So how are you approving a grant without deliverables on this inventory one?
Generally speaking, what we're going to have is an application. You'll have the program set up that you'll approve. Then there will be a grant application where the applicant provides the sufficient evidence and information that's necessary for Frank and his team to look at. Then there will be a grant agreement between the city and the person that will outline the deliverables and everything that's necessary, so that we have an instrument from which to operate under, if that makes sense.
And we are dotting the I's and crossing the T on what that application looks like. And so with the mayor and the city administration approval, we'll provide that to you prior to us coming to you to ask for your approval on the program, so that you'll know what it is we're requiring from these individuals. But the city attorney is correct. You'll put together an application. We'll review that application, maybe even ask for some additional info from you for us to make that decision in terms of whether or not we're going to grant you the grant.
Okay.
President Fox.
Thank you. I just wanted to ask, you mentioned at the beginning that you had in the loan program, I think 56 applicants, but only 5 loans that were given because some of them were maybe not in the city of West Palm Beach. But can you mention a few other reasons, maybe they weren't qualified? I guess, will this program be easier to qualify for, or just what were some of maybe the other issues why, I guess, 50 applicants didn't receive loans?
And I don't think it's going to be easier to qualify for because the main issue was that a lot of them were in the unincorporated area of the city of West Palm Beach. Okay. And so what we've done is we've provided them with a link so that they can decide whether or not they're within the boundaries. there's always the opportunity for you to open your business inside the city of West Palm Beach, which we're trying to encourage as many people to do as possible. So, yes, those are the same criteria we had before, but I think in this case, we're just trying to make it easier for you to determine if you're on the right side of the street or not. And our hope is if they're not, they'll get on the right side of the street. They can live wherever they want, but we'd really love to have their business in the city of West Palm Beach.
But, Mr. Hayden?
Yes, ma'am.
Just based on our discussion, I think one of the barriers that you have indicated when we had it set up as a loan program would be removed with it being a grant program, and that is, the debt ratio that small businesses, were picking up. If it were going to be a loan, it was going to add to their debt, and that was a barrier. So that would be removed. So I think the grant program from that perspective will be more enticing because it's not going to add to the debt of that small business.
Right. Thank you.
Mr. Hayden, as part of your follow-up, I would like for you all to incorporate a mechanism whereby you could check in with these businesses every 2 years, every 3 years. I'd like to get data as to whether our grant program contributed to the success of businesses going forward, whether these businesses went out of business after they received it. Just getting some information on those lines.
Yes, Mr. Mayor. I think that's an excellent idea because that helps us decide whether or not we're helping or hurting the small businesses, minority-owned firms in this city. And so, yeah, we'll make that a part of our effort.
Okay. Commissioner Ward.
And that is a great point, and because I was thinking about a lot of just being in a CRA district, a lot of the grants that they've provided and the reimbursement conversation has come up, and knew what you guys would say, and that's why I get why we reimburse. But it may be worthwhile to look at their data as well and kind of compare, because a lot of those CRA grants are small businesses as well, not necessarily minority or women-owned.
Yes.
Commissioner Warren.
I think it's appropriate that we have safeguards in place and requirements that the business is domiciled in the city of West Palm Beach, and that the business owner, that they're certified as a SBE or MWBE. It's totally appropriate. Have we seen an increase in certifications? And if not, do you have an outreach plan in place in order to let the small business community know about these opportunities and the additional benefit of becoming certified?
The latter part is really is a yes. We have an outreach plan. We, on a quarterly basis, do events and invite people to it. And in answer to the first question, the minute they found out the city had some money available, yes, our increased rate of getting certification shot through the sky. So, yeah, it helps bring people to the table. But on top of that, we've been doing a good job, I think, working with the various departments to provide opportunities for businesses as well. Because getting certified is fine, but if you can't get some money in your pocket, it does no good. So it's a twofold thing. Yes, they know they can get some money if they get certified, but at the end of the day, they want some work. And so we work very hard with the various departments to ensure that that happens as well.
Okay, any other questions on this item? Thank you very much, Mr. Hayden, and your staff.
Thank you,
I look
sir.
forward to hearing more about this program going forward.
Thank you, sir.
Number 2, CDBG CV funding reallocation proposal. Ms. Johnson, are you going to tee this up?
Yes, thank you, Mayor. This item relates to funding that the city received from the Department of Economic Opportunity. That funding based on some timing issues and requirement issues in terms of the expenditure of the funds, have put us in a position where we are looking at freeing up those dollars from the proposed project when we submitted the application, and subject to the board's approval, moving that money to the community paramedic initiative, which would help us to expand that program. It's going to be a joint presentation between Ms. Ferrier, our Housing and Community Development Director, and Chief Matty, the Fire Chief. So with that, Ms. Ferrier.
Excellent. Thank you, Madam City Administrator. Good morning, Mayor, City Commissioners, and members of the public. Jennifer Ferriel, Director of Housing and Community Development. As stated by the City Administrator, the purpose of our discussion today is to talk about a proposal of and reallocation of grant funding to another eligible project. As stated by the City Administrator, this is a dual presentation between myself and our Fire Chief, Diana Matty. Some of the discussions or an overview of what we're going to be talking about today. We're going to give a little bit of some background in terms of the grant opportunity that was awarded to the city. We're going to talk about our original application and in terms of what other funding sources are going to support that project. We're going to talk about the proposed reallocation of those funds, particularly diving into the community paramedic program. We're going to provide also a tentative plan for that specific program, and of course, what are our next steps and what is the direction that we're going to need from you in order to move forward, should you decide that this is the direction that you'd like for us to proceed in. I want to say it was the last quarter of calendar year 2021, and the Florida Department of Economic Opportunity made available grant funding to local governments. And those fundings were funds that were awarded through the U.S. Department of Housing and Urban Development. And those funds, under the Community Development Block Grant Program, assisted local governments prepare and respond to the economic and health impacts of the COVID-19 pandemic. As a result, and under the eligible uses of the program funds, there's a variety of different activities that we were able to undertake, whether they were housing-related activities, public improvements activities, economic development activities. There's an array of different eligible programs that we could have funded. We had the opportunity to apply. Oh, I'm sorry. No, that wasn't for me. I'm sorry. We had the opportunity to apply for $567,974 under the funds made available through DEO. As a side note, the city did receive direct allocations from HUD under the Community Development Block Grant Program and the CV funds. We received two allocations of those funds, and they were awarded to other eligible activities. So in our discussion or in our thought process of what application we were going to submit, we really wanted to make sure that we were funding projects that weren't currently being funded through other funding sources. We were required to look at and conduct an analysis to ensure that we weren't duplicating services or programs. So as a result of that, we collaborated with the city's engineering department, and we wanted to allocate the funding to supplement a portion of the Clear Lake multi-purpose tri-rail project. This project was going to, or is going to, construct a multimodal trail and boardwalk connecting Palm Beach Lakes Boulevard to downtown West Palm Beach. The total estimated project costs were about $2.5 million. And these CDBG-CV funds were going to be used to partially support the overall project. We did receive commission approval on October 18th of 2021, and the application was submitted to DEO prior to its deadline of November 1st, 2021. Just a little bit of more detail in terms of the Clear Lake project. Again, it consisted of a multi-mode trail and boardwalk on the west side of the Clear Lake Trail, and it provided or will provide connection for bicyclists and pedestrians from Palm Beach Lakes to Okeechobee Boulevard. It's also going to create and expand sidewalks to allow for social distancing purposes, and it's, of course, going to provide a safe and equitable and sustainable transportation throughout areas of our city where safe and equitable transportation is currently not being provided. So city staff, we were very eager to fund this project. We undertook all of the different nuances that we needed to do. We made sure that the solicitation and the ITB that went out included all of the applicable language. We began to conduct all of the environmental reviews and all of the necessary documents in order to utilize the CDBG-CV funding. However, there was multiple items or multiple things that came about that caused us to reallocate the funds. The first thing is the delay in the receipt of funding from DEO. We submitted an application prior to November 1st, 2021, and we did not get a grant agreement from DEO prior to until September 29th, 2022. I think I put 10 months there, but that's actually more towards 11 months. So we waited almost a year And because the project overall is funded with multiple funding sources, including FDOT funding, did not have the luxury to wait additional time. We had to award the construction contract because FDOT, we had requirements and we had compliance and deadlines that we needed to adhere to. So we discussed the engineering services director who is here. He was able to identify one sales tax capital improvement funds to supplement the CDBG-CV funding. So that's why we're here today. One of the things that Mayor, that you always like to talk about is making sure that we're exploring the grants that are out there, that we're applying for grants, and we did not want to be in a position where we had to turn down this funding. So with that said, again, we kind of did another needs analysis, and we met with the fire department, and we identified the community paramedic program as a need in our city. The chief is here to provide additional information, but in essence, this program is going to target underserved populations throughout our city and assist with a variety of different aspects through either home visits, telehealth appointments, home safety checks, and other types of activities to assist undeserved populations in our city. We do anticipate to utilize the entire allocation of $567,974 for this particular program. And with that said, I'm going to ask Fire Chief Maddie to continue with the presentation. Thank you.
Thank you, Jennifer, and good morning, everyone. Mayor, commissioners, and staff. Ms. Johnson, thank you for having us here this morning to talk to you about the expansion of the community paramedic program. So this program was founded about 6 months ago, a little bit more, in June of 2022. Our community paramedic is here this morning, Lieutenant Bianco, and she has been working on program development. We started from, we knew we needed the program, and we had nothing going in that direction. We got the position filled, and she's been working to determine available resources, establishing community relationships with places like hospitals, nursing homes, rehabilitations, with the homeless outreach, the police department. Now, we've already got relationships with these different groups, but this is in a different fashion. This is not the emergency, someone's in dire need, we need to get them to the hospital right away. This is taking a slower approach, a more tactical approach to that patient's long-term care. And in that process, we've determined that the average cost per transport to the emergency room, cost to the fire department, cost to the city is $3,000. So each time someone goes, even for medically unnecessary reasons, it's costing the city $3,000. Since then, also, we were awarded 2 personnel in October 2022 in the SAFER grant. So our class just graduated, our new hire class. So now we're going to move those 2 other positions into the community paramedic program. So our existing needs, for this program to develop, we have the unmet needs in the community, such as social determinants of health. There are unscheduled episodes from chronic diseases. That could be a diabetic that gets COVID and it makes it worse for them simply because they're diabetic. And then again, those medically unnecessary EMS transports where it could be wound care that they really need, but we don't have the ability to do that in the emergency setting. They would need to go to a hospital for that care. Again, costing $3,000 just to staff the truck, the fuel, the everything, the medical supplies, not to mention the bills that the patient are then going to get from the fire department, from the hospital, and any extended care from there. We do not have physical space for our community paramedics. Our fire station downtown was built in 1979 when the paramedic program was barely a blink of an eye at that point. And so we're going to be looking for physical space. And we don't have a telehealth medical reach back vendor in place. So a lot of us went to Zoom doctor's visits during the pandemic, and that's become more of the norm and more accepted. And so we're looking to expand into that for these community paramedics. They could get on the phone or the iPad with a telehealth doctor and do those visits without them having to go to the emergency room. So this next slide is just a snippet of 3 months of service demands for just 2 of our trucks, and these are both in the low mod areas, and these are Fire Station 1, so the rescue truck that runs out of Fire Station 1 here at 5th and Dixie, and then the one on Station 3 up at 50th and Broadway. In just 3 months, those 2 trucks ran nearly 2,000 calls themselves. That's busier than some fire stations in this county run in a year. Okay, just 2 trucks at 2 stations. Yes, ma'am.
Just a quick question. You said low mod. What does that mean?
Commissioner Lambert, to answer your question, low mod areas are the areas in our city where we have a a high concentration of low-income households. So that means that 51% or more of the individuals residing in that household have incomes at 80% of the area median income or below.
What does the mod mean? Like the word itself?
Low to moderate income.
Thank you.
Yes.
And let me just add a footnote. That ties into this program because it's CDBG and everything you have to use that money for is within those areas.
And by the way, Chief, while we have a little bit of a pause, that $3,000, the city does not get reimbursed for that amount at all,
No, sir.
right? No insurance
No,
reimbursement?
the medical billing would be above and beyond that, and for folks that are on Medicare, Medicaid, or private pay where it's a managed care, we're looking at maybe $250 that the city would get back, and that's months, if not years down the line.
Okay.
Sure. So then, at the bottom of this slide, when I say target call types, it's, you know, these are calls that we think we can do something about with a community paramedic program. Target meaning somebody fell, somebody's having a sickle cell crisis, it's a diabetic, or there's some kind of behavioral, things that are gonna make them more susceptible to, financially susceptible to COVID-19 and other diseases that are very preventable. So, and this is, again, just a 3-month look at just the areas of two of our busy rescues that are in those areas. This chart here, this is a density chart, what's commonly called a heat map. So the darker the purple you see, that's where the density of the calls is. And this was overlaid with census tracts that align with the CDBG priority areas. So that purple right down there in the middle, where you can see right near downtown, it's right where the mouse is moving right here. This is right down where we are right here. And then this is out Palm Beach Lakes, Clear Lake right in here. And then the Broadway corridor up in here, you can see a lot more dense call volume. Then in this slide, it's just separated. This is fire-related calls. And then it's broken out again by medical. So again, the darkest of the blues are the higher frequency of calls that occur in the city. So the current organizational chart you'll see on the left, it has a EMS chief, 1 lieutenant, and then 2 firefighters. The 2 firefighters on the bottom left were the ones that were approved in the SAFER grant. On the right, the proposed would allow a lieutenant and a firefighter to team up, and we can set them out in a different rotation, different parts of the city. That way they're working together to deal with whatever the issue is with certain patients. So what does the scope look like? So we're going to try to connect these patients to social services. There's a lot out there, and navigating that is very difficult. But that's what Lieutenant Bianco has been doing over the past 6 months, is gathering all that information to be that conduit between all of these services and these people with certain very specific needs. We're going to try to reduce unnecessary transports to the emergency room. Again, it's a burden on not only the fire department in the city, but it's also a burden to these folks that really they didn't need to go to the emergency room for whatever this wound or injury or condition is. We're going to try to reduce their susceptibility to COVID-19. If we're taking better care of our diabetes or our blood pressure or any of these other chronic diseases, we're less susceptible to COVID-19. Tracking patient outcome. We're gathering all the data we can. We've started getting out in the community and making patient contacts on those certain call types, repeat users of the 911 system. We've got some patients that call 911 for EMS 60 times in a year, you know, and those are the types of folks we're going to target first. And then tracking that data over time. But one of the things we would like to do is allow our community paramedics to have space at the Eva Mack Community Hub so that we can really work on connecting them to services. We could look at making office hours or however that pans out, but that's a place where we would have space, we could have the community paramedics there on a certain schedule, and they could meet the people, not only that need the services, but also the other folks that are there providing the services. This is just a rough budget of the proposed use of the funds. The salary for the lieutenant for the remainder of this year. Some operational costs, we're gonna get 4 vehicles, and again, those aren't detailed out just due to supply chain issues. We can't identify what's there just yet because that kind of ebbs and flows by the day. Medical supplies, we know we're gonna need things that are slightly different than what we do in the emergency setting where someone has a traumatic injury or a crisis type heart condition. This is gonna be changed slightly to more long-term care. And then health call. This is just one vendor that we got a quote from that does telemedicine. And so it's iPad or tablet based, and we can work with a physician on the other end of the line to deal with whatever the crisis is with the patient. And then additionally, some vaccine distribution and health education. We may need to do diabetes information classes or how to manage your blood pressure, things of that nature, so that we can be more comprehensive in the health care of our citizens. Okay, so the next question would be, well, how are we gonna sustain this once the money is gone? So I know a couple of years ago when we were first starting to get this program going, there was questions, how are we gonna pay for this? We talked with a lady that was from DHS, Department of Health Services, at the federal level, and they had funds, but you had to have an existing program. So that's one of the ways. We'll circle back with them. We're gonna look at partnering with the hospitals. We had some discussions with them, specifically Good Sam, prior to COVID when everything kind of derailed. Medicaid programs, there's funding opportunities within Medicaid. There's existing grants, just like the CDBG dollars we're talking about now, but also the Assistance to Firefighters grant has a community paramedic application portal. We're going to resume some conversations we were having before COVID and initiate conversations with some of the other foundations that we have here in the city. Once we have telehealth established, once we have that ability to bill for some of these services, we're going to look at working with private payer and insurance companies. Some other programs in the country have had success with that, so that we're going to follow suit. So, all right.
Chief, before you go, all right, so this money will keep the program going for how long?
Just about 2 years.
Because as I look at your budget, it says that the lieutenant's position is funded till September 30th. Is that correct? Am I reading it right?
Yes, Mayor, and we're talking about, for this specific funding source, because there is an expenditure deadline for these funds, we are also looked at other allocations of CDBG-CV to cover for the following year. So this is just for this specific budget or for the CDBG-CV funds that we're going to amend our application to the DEO, but we have other funding sources to support it for another year.
Okay. All right. Commissioner Warren.
This is also in regards to the sustainability of this initiative. The last slide that we looked at, well, the current slide, who's going to be responsible for this follow-up? Who's going to pursue these funds? Where does that accountability fall?
With me, within the fire department. So it will be my direction to our EMS chief and to the 2 lieutenants that are in the program to explore these avenues. And they went to a conference in October there was a boot camp, I guess, an 8-hour full-day boot camp on community paramedics. So it's an emerging trend nationwide. There's been programs in place for 10 years, and there's a lot of us in Florida that are just getting our feet on the ground and establishing all of these networks.
And let me just add, as the board is aware, I mean, the mayor just brought on a grants strategist that certainly would be available to work with Chief Maddie and her team to look at additional grants as well. So, it will be a coordinated effort in terms of looking at grant funding.
Commissioner Ward?
Could you just, because this is kind of a new concept, could you just walk me through, obviously some of this is education. I think it's great to have a physical location for purposes of educating our public. Can you just walk me through how this actually works if someone calls into 911, how it then gets diverted between the community paramedic or just a regular call, just because you're asking questions of the person of what their targeted areas, and then you decide who to send?
Sure, so I'll give you an example. So somebody calls 911 and they have a leg wound that they're supposed to get rechecked. They want to go to the hospital. The paramedics get there, and really the person is not in any crisis. They have a wound. And so they could reach out at that point to the community paramedic to come and spend some time with that individual, or what our intent is to initially start with the high utilizers. So the people that are constantly calling 911 for maybe non-emergencies or just for primary health reasons because they are out of meds or they can't afford the transportation to the hospital. So, I mean, we find a lot of these things that are really just social determinants of health that, we feel like we can help with. So it wouldn't necessarily be a diversion from 911 in the sense that dispatch would make that call. This would be us more being proactive with those individuals who we know are already calling, just to get started. So another mechanism that we have in place, just for an explanatory purposes, is right now in our medical report that we do on a tablet, if the paramedics go to the house and they determine, okay, maybe we take them to the hospital, maybe they stay at home, we can fill out a referral, and that email goes to the community paramedic, and then she'll get it the next day, take a look at the report. What am I following up on? Okay, well, this person's med cabinet is a disaster, or they haven't, they have some chronic disease where they're supposed to be taking care of X, Y, or Z. They're not doing it. How can she then intervene before the next time 911 is called to try to straighten some of those things out? Yes, sir.
I think I had Commissioner
Oh,
Lambert.
sorry.
Thank you so much. I think that's a great question, and this is something that we've been hearing for many years prior to when you were on the commission. So I encourage you and staff to reach out to Commissioner Moore and any other commissioners who aren't as familiar with this. I think that the social determinants of health and the disparities that we see in our community, I'm so grateful to see these funds being used for this. I think that I had a chance to speak with Lieutenant Bianco at the firefighters' holiday breakfast, and I think that something else that's very important to the success of this program is hiring the right person. From what I could tell from our conversation, you care very much about these individuals, and that what you were talking about, Chief Maddie, that conversation and reaching out to them and building that rapport with them. And we've heard that with the homelessness outreach for years, that it takes building that rapport over time. And I think that preventative care and getting in front of these calls will hopefully help us to be more responsible with our dollars. And so I look forward to seeing this program continue to grow and to flourish. And I just wanted to say, thank you to the mayor, to staff for continuing to be creative and look for these grants. I know that this is something we've wanted to fund for a very long time. Thank you.
Commissioner Baduzzi?
Thank you, and I think that this is a tremendous program. Not only will it help our residents with resources, but it'll actually help our fire department in responding timely to calls, because if we can divert some of those people, some of those individuals who are the frequent flyers and don't really require emergency assistance into other programs, then it's fewer calls that we have to respond to and more availability for true emergencies. So with that being said, I know that we are going to, someone calls 911 with a chronic issue. We're still sending paramedics there to make sure it's not an acute issue that requires, EMS or transport at that moment. then we're going to be, sending the referral over to the community paramedic program. But will we also, and I think you mentioned this, will we also be going through our records from the past and looking for those frequent flyers and saying, hey, let's reach out to them before they reach out to us again with another issue?
Yes, Commissioner Peduzzi, that's exactly what Lieutenant Bianco has been doing for the past 6 months, is analyzing all of that past experience. Who are those people? What are they calling about? What are those call types? What are we missing with the 911 system? And to Commissioner Lambert's point, the people that we're putting in this program are not, they're different. They're different in a good way, in the sense that they're willing to take that extra time with the people that need us. This isn't an emergent call where we need the person who excels in trauma to get this person to the hospital immediately, and it's a life or death situation. This is someone that has the heart, the personality, the fortitude to deal with somebody maybe months and months down the line. Because I don't foresee this as saving 20,000 people. I think we're going to do really good for a small number of people that really need it.
Follow up, Mayor?
Yes, sir.
So when it comes to the proper certification and licensure, we're not nurse practitioners necessarily. We're not, different people have different levels of certification. But that's why we'll utilize this telehealth. So we're really like this conduit, this go-between that makes sure that people are getting the services. We're not necessarily providing the medical services ourselves. Maybe in some cases you could provide it as long as it falls within our EMS licensure.
Correct.
And would this be under our medical director's supervision, also the EMS medical director's supervision, or will we be just relying on the telehealth?
No, we would maintain care under our current medical director that provides for the EMS service that the fire department provides for paramedic and EMT. But with this would be a relationship between the patient and that doctor that's on the other end of the box.
So we're just
we're just
facilitating that.
it.
Yes.
Okay,
We're
thank you.
really community facilitators. Yes, ma'am.
President Fox and Commissioner Lambert.
Thank you so much. I remember a meeting with a team of, from the fire department and from Good Sam back in early 2020 before COVID, and I'm excited to have this move forward. I know that the hospitals were mentioning that it's not just the cost, I guess, of the transport, but also the fact if they could have less people in the ER, they have more time to actually get the people that need to be in the ER, quick service, so that this would help them. But I guess I have a couple, my first question would be, when we're talking about the $3,000 for transport to the ER, and you're saying that some of it is reimbursed, but is there a way that we would know how many dollars we're saving? In terms of when we're talking about moving this program forward, we might actually be saving money that that money could go towards paying for this in the future, the money that we would have been paying for the calls that we're not having.
We will be able to estimate, but that's why we need to be very diligent on data collection going forward so that we can theorize, if this person would have called 911 10 more times this year, there's $30,000 right there, and this is maintenance costs, fuel, the salaries of the personnel, it's everything. That's where Medicaid has determined our cost is, and that of that, we get very little back from insurance and managed care providers. So as we move forward, we're going to track that very diligently, and we'll be able to estimate, maybe a year from now or 6 months from now, we impacted this number of people. We feel like we prevented this many. If we can get somebody to graduate out of a diabetic program where they're taking care of themselves and they're no longer having those big insulin drops or blood sugar drops, they're affording, we're able to afford our insulin now. We're going to try to graduate them from our program so that our hands are off. We've done our job. They're in a better place, and we can move on to another patient. Did I get all your questions?
Commissioner Lambert.
Can you remind us, what are the other municipalities or other entities that are utilizing this, and what's the impact that they've seen?
Sure. Palm Beach County Fire Rescue has been doing something called Mobile Integrated Health, and they actually have a social worker on staff. They have registered nurses in their program, so there's a higher level of training, but they've been doing it for quite a number of years, and they have that clinical social worker assigned to the program who leads it. One of the people that applied or submitted a letter of interest to come into this program, he's a registered nurse. He grew up in the city. He has deep roots in the city. So he's going to be joining the team here in another couple of weeks. So we're excited about that, and we're going to be doing some other interviews for the other firefighter position soon. So,
But we've also seen this in other states, right? Didn't you?
absolutely. There's a 3-week community paramedic education training course in Minnesota. They're doing it in California. It's growing, and it's growing faster than many of us can get a handle on, which is why I've seen it as a need for a long time. We've had these conversations as Commissioner Fox described prior to COVID, and then we just got derailed. And we're happy to be getting back on board with this program and trying to do what we can for these folks that really, really need us.
Thank you.
Mm-hmm.
President Fox?
Thank you. I think often what happens when people call 911 and there's an emergency that maybe they've kind of known about for months, or they don't have insurance, they didn't have the transportation to get to regular doctor's appointments and things like that. And if you call 911, you come, and it's whether or not they have insurance, they're taken care of. So I guess I'm curious in terms of ways that we can, is there a way to find the people that still won't call until it's an emergency because they're still worried about, not having insurance and transport and things like that? Is there a way to find those people, beforehand and help them with the telehealth program? Or, I'm just curious if there's any ways to, because I think that there will still be a number of people that are calling 911,
Right.
and that's the only time they're ever getting medical care because of insurance issues.
Right. Commissioner Fox, thank you for your question. One of the things that we talked about and the benefits that we found in having the fire department work closely with the Vickers House is to help identify those folks, right? Whether it's the homeless population that, if there's a need that they have, whether it's the folks that go in and try to get assistance for other needs, having that collaborative approach in one location, that's what we found it to be very beneficial. We also plan on having other organizations in that building, including the Sickle Cell Foundation. So there is a way that we can assist with that as we work with various organizations in the city. There's a way to identify that and be more proactive in that very same thing that you just stated. Thank you.
Any other questions before we go on? Okay. Commissioner Warren.
Thank you. I think it's very bright conversation to have when we're approaching the medical centers for their collaboration and for MOUs to talk to Commissioner Fox's point about the benefit to the emergency room and how, it will decrease their visits. And I just think that that's really good to include. On slide 6, going back, we identified alternative funding sources. So will the 1 cent sales tax cover the original purpose of this funding completely?
Yes. So that project is fully funded and it's moving forward.
Okay.
All projects are moving.
Okay.
Okay, any other questions before we continue? Okay.
All right. So just what are the next steps? So where do we need your assistance in? So I think we've got some good feedback today in terms of an understanding that you'd like to see this program move forward. So at an upcoming city commission meeting, we're going to need your approval to accept the funds and appropriate them accordingly, and to also amend that application to the Department of Economic Opportunity. We're then going to work with the Human Resources Department to amend the city salary plan and to add the lieutenant that's going to help fund or help facilitate this position. We will also have to enter into an interlocal. When I say we, I mean Housing and Community Development with the fire department, because we are the subject matter experts in compliance with CDBG program funds. We're going to administer the compliance aspects of it, working with the fire department. So we will need an interlocal to do that. And then, of course, step 3, we want to see the program move forward. We're going to initiate it and continue to grow it, expend the dollars, because that's critical to to the success of the program. We have some dollars that we have to expend. And then with that said, I think that concludes our presentation. Thank you.
All right, so this is relatively time sensitive, right? Because we got to get this.
Yes, sir.
All right, commissioners, is there consent to, not a formal consent, just a general sense of willingness to move this forward? Okay, all right, so let's go ahead and get it scheduled for the agenda and
Yes, sir.
get it going. All right, thank you very much.
Thank you.
Thank you,
May-
staff.
Questions
Thank you.
before they, okay, we're good.
Mayor, if I may add, just one last thing, not related to the subject matter, but tomorrow we are going to have our first ribbon cutting for our community garden in Coleman Park at 10 a.m. So I know this is something that the commission really wanted to see, so I just want to remind you that that's going to take place tomorrow.
Fantastic.
Thank you, Mayor.
Thank you. All right, I don't have anything under Mayor's Matters. Commissioners, you have anything for the good of the body? Commissioner Lambert?
Thank you, Mayor. I just, these two items that we had today had a lot to do with data and data collection and the stories that could come out of these two programs. And I think that the stories could be used not only for goodwill of what the city is doing and how we're implementing city dollars, but also for added utilization of the two programs. And I know you have just hired a new chief information officer or the
Director of Communications.
director of communications. And I just, I would hope that she gets immersed in these and to help spread these stories.
Thank you. Commissioner, there is one thing I wanted to bring to your attention. You may have heard over the weekend, we had an unfortunate incident where there's a group that was displaying on the AT&T building a swastika. I have been in touch with our police department. They are undergoing an active investigation, working with the FBI. Apparently this is a thing. I know it was happening up in Jacksonville. I've heard it's in other countries. I'm going to be issuing a strong statement against anti-Semitism. This is not what our city stands for, et cetera. So we'll be getting that out this afternoon. So didn't know if you all heard about that or not, but the city will be issuing, I will be issuing a statement on behalf of the city this afternoon. All right? Okay, hearing nothing else, this meeting is adjourned. Thank you all very much.